A new threat is emerging amid the high levels of seasonal flu activity. Avian influenza H5N1 is infecting humans. The CDC is urging clinicians and laboratories to expedite the subtyping of all influenza A specimens from hospitalized patients. This rapid subtyping is crucial to prevent delays in identifying human infections with avian influenza H5N1 viruses. A panzootic of highly pathogenic avian influenza H5N1 viruses is currently affecting wild birds and other animals in the United States. Since 2022, there have been 67 human cases of avian influenza H5 virus infection in the U.S., with most cases occurring in 2024. Most human infections have been mild, but there has been one fatality reported. Many infections were linked to unprotected workplace exposures, such as handling infected poultry or dairy cows. The CDC recommends subtyping all influenza A virus-positive specimens from hospitalized patients on an accelerated basis. This approach helps identify severe human infections with avian influenza H5 viruses and characterizes seasonal influenza viruses timely. Enhanced subtyping can avoid delays in identifying avian influenza H5 infections, especially during high seasonal flu activity. Most influenza tests do not distinguish avian influenza H5 from seasonal influenza A viruses, making subtyping essential. If a test result is positive for influenza A but negative for seasonal subtypes, it might indicate a novel influenza A virus like H5. Specimens should be prioritized for shipment to public health laboratories for additional testing. Subtyping is especially important for individuals with exposure to wild or domestic animals infected with avian influenza H5N1. The CDC still considers the risk to the public from avian influenza H5 viruses to be low but is closely monitoring the situation. Clinicians should ask patients with suspected influenza about potential exposure to animals and implement appropriate infection control measures. If avian influenza H5 infection is suspected, place the patient in an airborne infection isolation room with negative pressure. Start antiviral treatment with oseltamivir for hospitalized patients with suspected seasonal or avian influenza H5 without waiting for test results. Notify the health department promptly if avian influenza H5N1 infection is suspected, probable, or confirmed in a hospitalized patient. Public health laboratories should complete influenza A virus subtyping assays within 24 hours of receipt and report results to the CDC. Avoid direct contact with wild birds and other animals suspected to be infected with avian influenza A viruses and wear recommended PPE if necessary.